Hey everyone!
Happy Twin Tuesday!
Happy Twin Tuesday! Woo woo! Sending you some very consistent fun times in the office.
Yeah.
So we want to stay consistent with Twin Tuesday, but first and foremost, who are we?
I'm Dr. Madeline.
I'm Dr. Johanna.
And we are your awesome family wellness chiropractors here in St. Pete, Florida at Atlas Chiropractic Center. And our jam is
Pregnancy and postpartum mamas and your families.
Your families.
Yes.
We love to see them here.
Yes, we absolutely do. And we are coming at you live, like you said, from St. Pete, Florida. It's sunny, it's hot. And what are we chatting about today?
We're chatting about like mom posture, like what could that mean? Is it influencing maybe the headache, neck, upper back pain you're feeling?
Even mid and low back pain. It's depending on what phase of parenthood you're actually in.
Right. Like, is this true? Is this like a real thing? Could it be influencing it? And what in the heck can we do about it?
Yeah, so I will speak from experience. I know that when I became a parent, in the very beginning, my neck and my upper back were like lit, and not the good lit, like just like pain lit. And that's because I was constantly leaning forward every 2 hours, feeding my son all day, all night, and like the posture it caught up with me.
Yeah.
And it just wreaked havoc on my body. And I also had some other stuff like some wrist pain from that too. But then we get a couple months in, I'm not having to feed him quite as much, and I figured out the whole ergonomic thing for nursing. And then he gets heavier and I have to pick him up, and my whole core is no longer there because I was pregnant and I had a baby and I haven't had time to rehab it and restore it the proper way. And then my low back got lit.
Again, not the good
Not
lit.
the good lit. And I was like, oh my gosh. And now he's almost crawling and he's trying to pull himself up.
He is unstoppable.
So I'm holding him a lot, and you're probably very familiar with this type of, we call it mom, but it's parent posture. You know, on the hip, you're holding your baby so you can do whatever else you need to do with your dominant hand and your dominant side. So is parent, mom, dad posture a real thing?
Yep, it is. As you're jumping on here, if you're on live or if you're watching on the replay, let us know. Are you a parent? Have you felt these aches and pains or this weird stuff from holding your child? If so, say me.
Yeah. I know. I
guess not even if you're a parent. If you're an aunt or an uncle or something like that.
Or a friend or someone, you know. I think that a lot of people can relate to this. And it's so funny because Dr. Madeline had helped me watch Dakota one day. And she was like, after she said it, oh my gosh, like I feel this. It's so tight. I'm like, welcome to my world. But it's like this all the time, every day. So I relate with you parents out there. I get it.
Yeah,
I understand.
So let's talk about I want to talk about really freshly postpartum, like babies on the outside. You're trying to figure out life and what it is now.
Yeah.
And whether you are breastfeeding or even if you're bottle feeding, you're still feeding your baby.
You're still feeding, so you're holding, right? You're getting into what we would call like
a lot of flexion.
A flex posture, so it's where you're coming forward. Our normal posture, like if you want to check your spouse or your kids at home, when you look at them from the side, their ear should be in line with their shoulder should be in line with their hip should be in line with their knee, and then the ankle should be like just a straight drop down. And what you may notice, especially if you do have little ones at home, especially if you're a mom and you're breastfeeding or bottle feeding a lot, and then also when your kids get older, especially now that they are actually doing, I call it homeschool, but they're doing virtual school.
Right.
They are on their computers more because they have to be. Check their posture because they may be doing this.
Look, I will tell you, if you're a patient, you come in here and we're talking about if you're at a workstation, and now this is going to be just a lot more prevalent because at least the kids in school here are at home and they're on computers that have to do their schoolwork. I think that's a crowding across the nation right now.
I think it is too, yeah.
Even if you have the best ergonomic setup, there's only a matter of time until you get tired and lazy and you start to creep in more like this.
Yeah,
there really is.
Yeah, I mean, it just happens as the day goes on because you're expected to be seated, you're expected to be there, be present, and get the job done. And a lot of people will just keep plowing through, and then they'll get up 5 hours later, like, oh my gosh, I've been sitting at my computer the whole time. Your muscles get fatigued and tired, your eyes get tired, so you come closer to the screen. All of these things happen across the board.
So yeah, you're breastfeeding, you're brand new, baby's fresh on the outside, and you're tired. So we've always talked about this when we talk about postpartum mamas. Like, you're just not getting the amount of sleep you were getting before, and sleep is so crucial to your healing process in your body. And it's just a reality at this point. There's no shame in that. We can't change it for you as much as I would love to, and allow all the parents to sleep forever. But what we can talk about is like, well, how do we support you more in that process? Because we know that you're a little bit more at that like deficit because you're not still getting the full amount of sleep to heal as much.
Yep.
But where can this, so we know like postpartum, we're feeding baby, we're leaning and changing baby,
holding baby.
so again, we're in that flex position like all the time. We as humans and our spines and our joints and everything are made to move. And the more we move, they say motion is lotion, the more those joints essentially stay lubricated and they move better and they move well, and they're not gonna have as much if scar tissue just from like sedentary type of stuff. Injury is a different story, but
So yeah, if we did the same posture a lot, like time and time again, that's what we consider a micro trauma. So your body learns that muscle memory and how to support those joints in that bad posture. Muscle memory is the same across the board. So we think about muscle memory when we're talking about like pro athletes, and they go through and they train so much. Like a golfer will train on their swing and train to make sure that those muscles know the proper way to do it. So in the point of competition, they can do exactly what they need to do. Your muscles have memories, and we teach you to do this time and time again. Then your muscles are like, this is what your posture is supposed to be like. And that's not good for your spine or how you feel or anything like that.
so much you can have headaches.
You can have headaches, neck pain,
upper
back pain, jaw pain from that.
Ringing in the ears,
Numbness and tingling down the arms and hands, carpal tunnel syndrome.
Really tight muscles, like
really tight.
We hear this a lot. I would say for like newer postpartum moms, definitely a lot of tension and muscle tightness here, and definitely like underneath their skull here, because again, that's putting a lot of stress on those muscles. They're having to be stretched and work all the time. They're tired.
And there's one muscle that runs from here all the way down into the upper back. So that's also why when they are tight, you may feel stuff here, but you could be feeling stuff all the way down here, and your adjustment may need to happen up here. That's why we do an exam, and that's why we check it. So we are checking that stuff too.
Okay. So we're in pain, we're not sleeping, caring for baby, doing the best we can, or even like toddlers, or as the baby gets heavier, just different things are going to come up and stress you out in different ways.
Right, in different segments of your spine can be affected based on how you're taking care of your little one and your kiddos and how that is shifting and changing. So even though we're focusing on the upper body, just apply this to all parts of the spine, because you may be watching this and think, well, yeah, I'm breastfeeding or I have a baby, but like I don't have neck pain, I don't have upper back pain. That's okay, because you may be someone that has low back pain. Maybe you had an epidural and you have residual pain in that area because there's scar tissue in that area because there was a needle that was poked into that area, and that's how your body heals and repairs. And if you look at the research, it takes about 12 to 18 months to heal that scar tissue out of that muscle. It just does. I mean, that's a medical textbook. That's not from us.
That's 12 to 18 months in general to heal a soft tissue injury, and there's going to be soft tissue injury with putting in, which again, like I don't want, when I was talking about this, it's not any judgment. This is just education.
No, I'm just throwing the info out there. So you know we know where you're coming from. We understand.
It's naturally going to take 12 to 18 months to heal that soft tissue injury, typically, alongside of, again, we talked about that you typically aren't sleeping as well because you're a parent, and again, I wish I could change that for you, like the sleeping part for you, but I don't have a magic wand. And postpartum mamas like that, your postpartum, your body changes so much, and you need so much extra nutrients to replenish what was taken from your body to grow a human. And then, of course, if you are nursing and feeding little baby, that's still taking extra nutrients. So all of these things, and that what we put in our body with our nutrients are what's going to be broken up and kind of put back out to replenish and rebuild and to feed baby if we're feeding baby. So keep that in mind as well. So that process might look a little bit different during that time too.
Oh, yeah, absolutely. Absolutely. Agreed.
So if we're stuck in flexion, essentially, if we're stuck like this all day or a lot of times of our day, and we're starting to feel those aches and pains and stuff like that, especially with what's going on right now, what is something easy that the parents or moms can do at home to reset this?
So there's some really good exercises that you can do. You want to, if you're in flexion, think about you want to get out of that. So if you're pushed forward, you want to get opposite. You want to open up everything and use what we call those extensors, those back muscles, all the muscles on the back side of your body and your spine. Because when you're like this all the time, the ones in the back get too weak and they forget what their job is and they think that this is good and it's not. So you have to retrain them.
Don't let them forget.
you have to retrain them, you have to wake them up, you have to balance that muscle out, so you got to open it back up. So we have a fantastic posture reset that we do teach our patients on how to do, and we can throw it out there. I don't want you to do it and think like, oh my gosh, this causes pain, like, but Dr. Madeline, Dr. Johanna told me to do it, like, so really
these are general things that you can try.
Exercises that you can try. If they cause any discomfort or pinching or anything like that, then that is a situation where you do want to talk to your chiropractor or your whomever that you're working with and see if there's an alternative that you should be doing, or if there's a missing link or something that's going on. So what's a good posture reset?
Definitely, like we said, getting back into extension. So normally I will just tell patients like a cat-cow, like a yoga move is really good because you are kind of getting a flexion extension. You're pumping those joints, which is good. But especially for like neck, head, like upper back stuff, you can easily just like clasp your fingers and put them like right at the base of that skull there, and kind of just like rest your head a little bit back where you're kind of gazing up, and think about just pushing your hand into your head into your hand, and creating that resistance. So again, normally we're stuck here,
and we're bringing it back, and we're resetting it.
Just hold for a couple seconds. You can reset.
So the thought process on this too is, as you're resetting your posture, when we're constantly in flexion, we're crunch, you're going to go to the opposite. So think about going from one extreme to the other, and that's how you balance back out in the middle. So I know we talked a little bit, we have a couple of people jumping on. We did talk about checking your posture for parent posture, but also your kiddos, and seeing if they're in that proper alignment. Your ear, when you're looking at them from the side, should be in line with your shoulder should be in line with your hip with your knee, and your knee with your ankle. And if you drop the straight line down, that's where your body should intersect. If there's any movement away from that, it means you have some crazy posture going on. So we were just talking about a posture reset to open it up, to get you balanced back out, because this is also not only going to be beneficial for our postpartum moms and our postpartum dads, but now across the nation.
Who is working on a computer?
Yep. Throw some emojis down or some comments if you're working at home now, and now instead of going to the office and having hopefully a good ergonomic setup, hopefully now you're working from your couch, your kitchen table, your kitchen bar, your bed, the floor. So, oh my gosh, you guys, I've seen some crazy posture the past couple of weeks, and some crazy flare-ups and things that people haven't had in a long time. It's like, and maybe you're going from working at a desktop that's set up ergonomically to now also sitting in a bad posture working on your laptop, which is not ergonomic at all.
There's a lot of extra stress going on around life right now.
So you can work on that posture reset if that's you. And now that kids are also doing virtual school, so they're sitting at their computers and they're working, and when they would be able to get up and move around and different things prior to this. So definitely, this exercises are not just for parents, but they can be for your kids too, basically.
Yeah. So let's do one for upper back too, I think, because again, if we're here.
Yep. I love the doorway stretch, and it's super easy. So there's two different stretches. The doorway stretch is like when you're constantly flexed forward, your pecs get really tight, and you may notice that your shoulders are rounding. This happens a lot with new moms and parents because they're holding babies in the front. And then anyone that's working on technology. So find an open doorway, so open your door. And you're going to bring your hands to both sides of the door frame, and you're just going to lean in. And when you lean in, just enough to feel a stretch. Don't face plant. Lean in enough that you're feeling a stretch. You're just going to hold for a couple of seconds, and you can just repeat that. Now, I also recommend going up a little bit higher, like your hands at your head height, and leaning in again, because you'll hit different areas of that chest and pec muscle area. So that way you're stretching, and that's opening this back up. Also, just stretching your shoulder blades back, like you're pinching a pencil in between them, and opening that up into extension. That's going to also contract the back muscles. It's going to wake them up and say, hey, this is your job. This is what you're supposed to be doing. Don't get lazy on me.
Don't get lazy. Yeah. We need you right now. Well, we always need you.
Yes, absolutely. Absolutely. So that's a really good one. You can do some deep breathing in that position too, which will help open up your diaphragm and making sure that you're reducing stress and you're just exercising your lungs and all that good stuff.
All the good things right now.
Yes.
All the good things.
Yeah, absolutely.
Yeah. So if you're struggling with some of that, try those out. Mm-hmm. If they're not working for you, you know where to find us. You can find us on Facebook or Instagram and message us. We have some other resources we can shoot your way or try to get you coupled up with the right people, that type of thing. Maybe we can do like a video call and kind of see what you're doing. We can do that. That's pretty cool. Technology is super awesome, right?
Yeah, it is. So we are glad that we do have it and we can utilize that. So that's super cool. And I was just gonna comment, and of course it went in one ear and right out the other. So Oh well, maybe next time.
Well, stay well. Keep up with all your awesome things you're doing to support your immune system, washing all your hands, that type of thing.
Yeah.
And we will see you next
Next week. Have a good one, guys. See you later.